Good day. Here's the latest news for today. COVID-19 vaccination shall be used as one of the major strategies to complement with the existing measures and practices to mitigate the spread and reduce morbidity and mortality due to COVID-19. As the need arises, method of sub-prioritization is developed. Here's Raymark Simanya for the full story.
Yes, Queen, the development of vaccines against COVID-19 is among the solutions that will greatly mitigate the increasing cases in the country, complemented by already existing measures and practices in place. Dr. Jerry Kalingasan, the chief of the Provincial IATF in Misamis Oriental, clearly explained the sub-priority groups for the COVID-19 vaccine. This after a consultation with all the agencies comprising COVID-19 vaccine cluster. The Department of Health, through the Task Group COVID-19 Immunization Program, developed a comprehensive plan for vaccine deployment and vaccination. For Priority Group A1, all workers in a health facility shall be taken as a group, facilities or institutions of prioritization in the following order of precedence, may be sub-prioritized based on historical admission of COVID-19 cases and allocated and occupied COVID-19 beds. A. COVID-19 referral hospitals designated by the DOH. B. Public and private hospitals and infirmaries providing COVID-19 care as prioritized based on service capability, starting from Level 3 hospitals to Level 2 hospitals to Level 1 hospitals and then infirmaries. C. Among hospitals with a common service capability, the order of priority shall be from facilities owned by the DOH, then facilities owned by the LGUs, and then facilities owned by private entities. D. Isolation and quarantine facilities such as temporary treatment and monitoring facilities and converted facilities like hotels and schools that cater to COVID-19 suspect, probable and confirmed cases, close contacts, and travelers in quarantine. E. Remaining hospitals including facilities of uniformed services not catering to COVID-19 cases. F. Government-owned primary care-based facilities such as urban health centers, rural health units, and barangay health stations, birthing homes, and local health offices to include the members of the BHERTS or the Barangay Health Emergency Response Team, contact tracers, and social workers. G. Standalone facilities, clinics and diagnostic centers, and other facilities otherwise not specified. Example, clinics, dialysis centers, dental clinics, and COVID-19 laboratories, dealing with COVID-19 cases, contacts, and specimens for research purposes, screening and case management coordinated through their respective local government units. And H. Closed institutions and settings such as, but not limited to, nursing homes, orphanage, jails, detention centers, correctional facilities, drug treatment and rehabilitation centers, and the Bureau of Corrections. In Misamis Oriental, the Provincial IATF already has an ongoing inoculation of COVID-19 vaccines to the different rural health centers down to the barangay health workers, the contact tracers, and the BHERTS. In the western side, we have Opol, El Salvador, Alubihid, Naawan, and Initaw, while on the eastern part, the vaccination started last week in the municipalities of Taguluan, Villanueva, Hasaan, Balingasag, Medina, Hingog, and Kinugitan. In total, the province already vaccinated 2,733 individuals, 1,802 of these from the hospitals, and 931 from the municipalities that started last week. Governor Bambi Mano and Dr. Kalingasan constantly remind the people to continue abiding by the health protocols as mandated by the IATF, as this can keep us safe while we are waiting for the allocation to finally get vaccinated with the COVID-19 vaccine. This is Raymark Simanya, aimed towards a clean and honest governance, reporting for the province of Misamis Oriental. Queen?
Thanks, Raymark. In another scoop, with the arrival of COVID-19 vaccines in the province, the Provincial IATF has established basic protocols and recommendations that are vital in addressing the current situation in our fight against COVID-19. Here's Danny Obshama Jr. for more details.
Yes, Queen. After the initial arrival of COVID-19 vaccines in the country, the province of Misamis Oriental is hopeful that it can benefit from the arriving vaccines.
With Dr. Jerry Kalingasan supervising the Provincial Health Office, he is working head-to-head with the Department of Health 10 in ensuring that the province can allocate the necessary vaccines needed. In connection to this, Dr. Kalingasan stressed out that the importance of the vaccines is to curb the abrupt rise of COVID-19 related cases. He added that in order to achieve herd immunity, 65 to 75% of the population should be inoculated. Additionally, basic health protocols must also be strictly followed and describe the fight against COVID-19 as a raging forest fire, and vaccines play an important role in preventing the spread of the disease by following preventive measures like social distancing and wearing face shield and face masks. Dr. Kalingasan also advised the people to not hesitate to get immunized, but instead grant it immediately and grab the opportunity to receive the vaccine. He accentuated that lactating mothers, pregnant women, and those who suffered from stroke are allowed to take the vaccine as long as there are no allergic reactions and blood pressure is controlled.
The provincial government of Misamis Oriental, in coordination with the Provincial Health Office, plays a vital role in helping to promote the vaccines that are currently available to the people. With these vaccines, hope is coming forth for a safer and healthy province of Misamis Oriental. This is Danny Obshama Jr., aimed towards a clean and honest governance, reporting for the province of Misamis Oriental. Queen?
Thanks, Danny. And that is the latest news for today. For more details, please visit the Misamis Oriental Provincial Information Facebook page. Once again, I am Queen Exclamador. Good day.